Yes, good morning. Doctor, do we have your testimony?
Yes.
I think it was submitted.
Okay, thank you.
It's 2 pages, short, sweet. Good afternoon, Chairman Oliver and Baker, members of the committee. My name is Dr. Denis Petro. I'm actually speaking in support of the bill, Compassionate Use of Medical Marijuana Act. I'm a resident of Pennsylvania, living in the beautiful Lehigh Valley in eastern Pennsylvania. I'm a board-certified neurologist with approximately 30 years of experience in neurology, clinical pharmacology, and marijuana research, and am recognized as the first clinical researcher to do a trial, double-blind, placebo-controlled trial, of a cannabis derivative, namely THC, in patients with spasticity associated with multiple sclerosis. This double-blind, placebo-controlled trial was published in the Journal of Clinical Pharmacology, a peer-reviewed journal, in 1981. Because of that work, I attempted to do further research using any of the cannabinoids available through the government, and because of the government's position on research with marijuana, was unsuccessful in obtaining any cannabinoid. I did, however, testify in 1987 at the previously mentioned DEA rescheduling hearing in Washington, D.C. Just to briefly state what Dr. Francis Young had said in his opinion, he said it would be unreasonable, arbitrary, and capricious for the DEA to continue to stand between sufferers and the benefits of the substance marijuana. His opinion actually was almost verbatim from some of my affidavit and direct testimony at the time of that DEA hearing in 1987. Unfortunately, I missed the Schaefer Commission in 1972, but in any event, I did testify also at the IOM, at the Institute of Medicine, White House-sponsored meetings with regard to therapeutic cannabis. And also, I've been essentially certified as an expert in a number of cases worldwide involving drug development, drug toxicity, clinical syndromes in neurology, and have, to my best of my knowledge, never been disallowed from testifying based on my record. And also, I've participated in the development of a number of major drugs in the United States and worldwide, including 3 of the most prominent antidepressants sold worldwide. In 2 of those cases, I wrote for the company's reviews of the drugs with respect to drug toxicity issues. Marijuana is recognized by the medical community as safe and effective in the treatment of pain and muscle spasm associated with multiple sclerosis, spinal cord injury, and CNS injury. This is particularly important in patients who have not received relief with conventional therapy. And believe me, a lot of patients do have difficulty treating these complicated syndromes. Conventional therapy has the possibility, fatal overdose, and addiction liability seen both with opiates and with drug combinations. I don't base my opinion on any irrational reefer madness concepts, but I do base it on peer-reviewed journal articles originating with my research published in 1981 and incidentally conducted at the Hershey Medical Center in Hershey, Pennsylvania. This research was confirmed by 8 subsequent clinical trials. Finally, in the year 2000, in the journal Nature, an article was published and received worldwide publicity called Cannabinoids Control Spasticity and Tremor in a Multiple Sclerosis Model. Now, the critics had scratched their head when this study came out, wondering how the mice enrolled in the study were able to distinguish between, quote, active and placebo drug. But this study concluded that the study provided a rational basis for patients for the therapeutic potential of cannabis and the control of symptoms associated with multiple sclerosis. Based on this research and other research, the government of the country of Canada approved a cannabis extract called Sativex for the indication adjunctive treatment for the symptomatic relief of neuropathic pain in multiple sclerosis in the year 2005. Later, they also approved it for cancer pain. The neuropathic pain in MS is similar to pain seen in other neurologic injuries. When compared to potent opioid analgesics, such as Vicodin, etc., marijuana is incredibly safer, and it's certainly effective in treating patients. I would remind the committee that every year patients die from either inappropriate use or overdose from opioid analgesics. In preparation for today, I just looked at one of the drugs, methadone. In the United States, in the year 2007, over 4,000 patients died from methadone overdose. I would challenge the committee to find one reported death from marijuana overdose in the entire medical literature. Finally, I would like to remind the committee also of a patent submission from the Nobel Prize winner Julius Axelrod at the NIH. I have in my submission the patent number. It's 6630507. This is a patent for cannabis as useful in the prevention and treatment of age-related inflammatory and autoimmune diseases and nervous system disorders such as Parkinson's disease, Alzheimer's disease, and HIV dementia. I would remind the committee that this is a patent applied by the National Institutes of Health by a Nobel Prize winner. Also, I would also remind the committee that in the IOM report, they talked about the chronic toxicity issue of inhaled marijuana. I would remind the committee that there is a gentleman who recently received his 115,000th cannabis cigarette to treat his chronic pain syndrome. He has taken cannabis daily for 28 years by the government-approved Mississippi plantation marijuana. He is still receiving this drug daily. No pulmonary problems, no psychosis, treatment of his pain syndrome. So I'd like to end by saying that I support the passage of this bill in recognition of the many patients I've seen over the years, including Cheryl Miller, a patient in New Jersey of mine who died in 2003, and also the gentleman, Mr. Wilson, who's in the room, who is not allowed to even mention his MS in his upcoming trial in New Jersey. Thank you for your attention.